A heart attack occurs when the flow of blood to the heart is severely reduced or blocked. The blockage is usually due to a buildup of fat, cholesterol and other substances in the heart arteries. The fatty cholesterol-containing deposits are called plaques. Plaque is a sticky substance that can build up on the insides of your arteries, similar to how pouring grease down your kitchen sink can clog your home plumbing. Sometimes, plaque deposits inside the heart arteries can break open or rupture, and a blood clot can get stuck where the rupture happened. If the clot blocks the artery, this can deprive the heart muscle of blood, and without blood flow, the affected heart muscle will begin to die. If blood flow isn't restored quickly, a heart attack can cause permanent heart damage and death. The vast majority of heart attacks occur because of a blockage in one of the blood vessels that supplies your heart. A heart attack is a life-threatening emergency. If you suspect you or someone you're with is having a heart attack, call immediately your local emergency services phone number. Time is critical in treating a heart attack, and a delay of even a few minutes can lead to death. Heart attack symptoms. Some heart attacks strike suddenly, but many people have warning signs and symptoms hours, days or weeks in advance. Someone having a heart attack may feel chest pain. This can be mild and feel like discomfort or heaviness, or it can be severe and feel like crushing pain. It may start in your chest and spread to other areas like your left arm or both arms, shoulder, neck, jaw, back or down toward your waist. Chest pain or pressure that keeps happening and doesn't go away with rest may be an early warning sign. This pain happens because a blockage stops blood getting to the heart muscle. The pain will not ease with rest. Many people think that every heart attack starts with a crushing pain in the center or left side of their chest. Pain in that area is the most common symptom. But about a third of patients who have had heart attacks, often older women or people with diabetes, don't have a chest pain. Have pale skin and lips, may have a blue tinge. Nausea or stomach discomfort, experience pain similar to indigestion. Heart attacks can often be mistaken for indigestion or heartburn. Vomiting and fatigue, excessive sweating, choking sensation, shortness of breath or trouble breathing and dizziness, collapse without warning, heart palpitations, have a rapid, weak or irregular pulse. Anxiety or a feeling of impending doom. Silent heart attacks are so mild you don't realize you've had one until later. You might think you've had heartburn. And your second heart attack may not come the same way as the first. The heart is a tough organ. It will keep working despite injury in one section. A heart attack, however, can cause cardiac arrest when your heart isn't beating properly. Sometimes, the first symptom of a heart attack is sudden cardiac arrest. The sudden loss of blood flow to the heart may cause the heart to beat chaotically. This is known as ventricular fibrillation. This can initiate a sudden cardiac arrest which requires CPR and defibrillation immediately. So if you experience any of the listed symptoms, be careful not to incorrectly self-diagnose. Symptoms can last for several days or even weeks. The main goal is to prevent further damage to the heart and restore blood flow. Now let's see who is most at risk for a heart attack. Several key factors affect your risk of having a heart attack. Unfortunately, some of these heart attack risk factors aren't things you can control. Age and sex. Your risk of heart attack increases as you get older. Men age 45 and older and women age 55 and older are more likely to have a heart attack than are younger men and women. Tobacco use. This includes smoking and long-term exposure to second-hand smoke. High blood pressure. Over time, high blood pressure can damage arteries that lead to the heart attack. High blood pressure that occurs with other conditions, such as obesity, high cholesterol or diabetes, increases the risk even more. High cholesterol or triglycerides. A high level of low-density lipoprotein (LDL) cholesterol, the bad cholesterol, is most likely to narrow arteries. A high level of certain blood fats called triglycerides also increases heart attack risk. Your heart attack risk may drop if levels of high-density lipoprotein (HDL) cholesterol, the good cholesterol, are in the standard range. Obesity. Obesity is linked with high blood pressure, diabetes, high levels of triglycerides and bad cholesterol, and low levels of good cholesterol. Diabetes. Blood sugar rises when the body doesn't make a hormone called insulin or can't use it correctly. High blood sugar increases the risk of a heart attack. Metabolic syndrome. This is a combination of at least 3 of the following things: enlarged waist, high blood pressure, low good cholesterol, high triglycerides and high blood sugar. Having metabolic syndrome makes you twice as likely to develop heart disease than if you don't have it. Family history of heart attacks. If a brother, sister, parent or grandparent had an early heart attack, you might be at increased risk. Family history of heart disease. If you have a parent or sibling with a history of heart disease, especially at a younger age, your risk is even greater because your genetics are similar to theirs. Your risk increases if your father or a brother received a heart disease diagnosis at age 55 or younger. It also increases if your mother or a sister received a heart disease diagnosis at age 65 or younger. Not enough exercise. A lack of physical activity, sedentary lifestyle is linked to a high risk of heart attacks. Regular exercise improves heart health. Unhealthy diet. A diet high in sugars, animal fats, processed foods, trans fats and salt increases the risk of heart attacks. Stress. Emotional stress, such as extreme anger, may increase the risk of a heart attack. Illegal drug use. Cocaine and amphetamines are stimulants. They can trigger a coronary artery spasm that can cause a heart attack. A history of preeclampsia. This condition causes high blood pressure during pregnancy. It increases the lifetime risk of heart disease. An autoimmune condition. Having a condition such as rheumatoid arthritis or lupus can increase the risk of a heart attack. Heart attack prevention. How can we reduce risk of having a heart attack? There are many ways you can help yourself and reduce your risk of a heart attack. It's never too late to take steps to prevent a heart attack even if you've already had one. Here are ways to prevent a heart attack. These include: follow a healthy lifestyle. Eat a healthy diet. Examples include the Mediterranean or DASH diets. A plant-based diet approach is an excellent alternative. Maintain a weight that's healthy for you. Your primary care provider can advise you on a healthy goal weight and provide you resources and guidance to help you reach that goal. Exercise regularly. Aim for 30 minutes of moderately intense physical activity 5 days a week. Quit tobacco products. This includes smokeless tobacco and all vaping products. Reduce your stress. Consider techniques such as yoga, deep breathing and meditation. Manage other health conditions. Certain conditions, such as high blood pressure and diabetes, can increase the risk of heart attacks. Ask your healthcare provider how often you need checkups. Take medications as directed. Your healthcare provider may prescribe drugs to protect and improve your heart health. Don't just take medications when you remember to or when you have a doctor's appointment coming up. Schedule a checkup. Find a primary care provider and see them at least once a year for a checkup or wellness visit. An annual checkup can catch many of the early warning signs of heart disease, including signs that you can't feel. These include your blood pressure, blood sugar levels, cholesterol levels and more. This can also help treat problems sooner rather than later. Thanks for watching.